Recording a 12-lead ECG or EKG. A 12-lead ECG or EKG electrocardiogram is used to record the electrical activity of the heart. Some advanced first responders may be trained in recording 12-lead ECG or EKGs. Electrical impulses start at the sinoatrial node in the heart. The impulse travels through adjacent fibers to the atrioventricular node, then along the bundle of His which sits in between the two ventricles, before it spits into the bundle branch fibers, right and left. The left bundle branch splits again into the left anterior hemifascicle and the posterior hemifascicle. The bundles terminate eventually in the Purkinje fibers. As the impulse passes, the cardiac muscle fibers contract, first atria, then ventricles, and a full heartbeat occurs. Characteristics of the ECG or EKG. P-wave is the ECG display of atrial depolarization and contraction. QRS complex is the ventricular contraction. T-wave is repolarization of the ventricles, for example, their return to a resting state. Q-wave is the first part of the QRS complex, but only if it goes downward. R-wave is the upward deflection of the QRS complex, whether there is a Q-wave or not. S-wave follows R-wave and is called as such as long as the S-wave dips below the baseline. ECG timing. 5 large squares per second, 300 large squares per minute. So 1 large square is 0.2 seconds. 1 small square is 0.04 seconds. Heart rate of 60 is 1 QRS complex every 5 squares. The PR interval, measured from start of P wave to beginning of QRS, should be 0.12 to 0.2 seconds e 3 to 5 small squares. QRS is normally 0.12 or 3 small squares. ECG procedure. The patient will ideally be still, as skeletal muscle movement will be picked up on the ECG. The lead must be applied in the correct places, with adherence to the skin maximized by shaving the areas, enough for the lead to be applied. There will usually be 10 leads. Leads are named. They are V1, V2, V3, V4, V5, V6 to be applied over the thorax, and forelimb leads to be applied usually at each wrist and each media lower leg. These are usually labeled LA, left arm, RA, right arm, LL, left leg, RL, right leg. The 12 parts of the ECG are labeled V1, V2, V3, V4, V5, V6, VR, VL, VF, 1, 2, 3. The V leads record activity from the corresponding region of the heart that they sit next to. For example, V1 sits to the right of the sternum at about 4th intercostal space. That is over the right ventricle. V2 is on the opposite side of the sternum. V3 is lower and lateral to V2, corresponding to the septal region of the ventricles, and so on, up to the left ventricle recorded by V6. The last 6 of those leads look in a vertical plane at the heart. VR records the electrical activity from the right side, either right atrium, VL from the left, VF from the base. I and IA record information from the vertical plane in between left vertical and the base of the heart, and late II in between right vertical and the base of the heart.